You've got a friend in me. You've got a friend in me. You got troubles and I got them too. There isn't anything I would not do for you. You've got a friend in me. You've got a friend in me.
Unbelievable but true. The Lotto jackpot has climbed again. Friday, May 29th. It's your chance to be a millionaire. With a Lotto jackpot of $1,685,000. You can make your dreams a reality. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next Lotto jackpot, $1,685,000.
Welcome to another edition of Round Table Talk. Of course, today is Wednesday, May 27. You were here about 4 weeks ago. Our special guest, yes, you guys were here on May 6th. Our special guest, the Chief Medical Officer, Dr. SIMONE KEIZER BEACHE, the Medical Officer of Health, Dr. Roger DUNCAN. It's been a very testy, a very hectic last 4 weeks, and a lot has transpired. Give us a status update on what is happening in respect of COVID-19 in St. Vincent and the Grenadines. Dr. Beach, I think I'll ask you to start.
Okay. Good evening, and thanks for having us again. As you said, it's been quite a busy time. We have welcomed home 3 different sets of crew members. We started with Carnival Cruise Line, and then we had a small group from the Disney Cruise Lines, and now we have our Royal Caribbean persons at home. We have also welcomed home persons from Jamaica. Some students came in from Jamaica. And in between all of that, we have also been dealing with persons who have come in, whether they're going to quarantine here because they've been traveling from different places, or they're going into the Grenadines. So we have had quite a bit of activity in terms of persons coming home.
Yes, but I think the most current topic right now happens to be the group that came in yesterday from Royal Caribbean, 356 to be exact.
356, yes.
Dr. Duncan, how did that go?
Okay, how did it go? I think under the circumstances it went pretty well. We are on the verge of doing our own local PCR testing. We're doing the final touches in terms of having completed the installation and equipment and so forth. So we wanted to get these samples off to Trinidad as quickly as we could for testing. Why? Simply because the earlier we send them out for testing, the earlier time we could get these crew members off the ship and get them into quarantine at home, at least where they could see their loved ones, where they could, at least away from a distance or have a virtual hug, so to speak. And that was important for us and we were able to actually test all 357. There was an additional one, 357 persons yesterday. My staff work hard. They called me all sorts of names yesterday: slave master, slave driver, and that sort of thing. I was behind them pushing, edging, egging, let's go, come on. But they did it, and at the end of the day, we're quite happy with what we did, and we're pleased to know that all the samples have been taken. They all are in Trinidad currently, and we should start getting back results soon, so we'll be able to communicate these results to these seamen.
Let's talk about the actual process. The ship landed, and what transpired after that and up to the end of your testing period? Okay,
so the ship landed and was brought to berth. There's a public health part of it where the ship itself has to get clearance to allow them to berth, in which my public health officers would deal with that part of it. Then we took off initially 29 seamen in whom we had a particular interest. And we were screened, and we took some demographic information and other epidemiological information from them, which we kept. They were then interviewed by immigration, had their passport stamped, and they proceeded to have a nasopharyngeal swab done. And those 29 were placed in a quarantine facility, a state-owned quarantine facility. We then proceeded in batches, I think, of 31, to get the others off to go through the same process, which is that interview with our public health staff, screened by immigration, get a nasopharyngeal swab done, and then they return to the vessel.
Let's talk about the 29 with whom you had a special interest, as you term it, because it's all over the media regionally and all that 29 of these seamen tested positive for COVID, and we know that that's not particularly accurate. Talk to us about that, Dr. KEIZER, or you yourself.
Well, these 29 seamen tested positive for exposure to SARS-CoV-2 virus. And they were positive either for IgG antibodies or IgM antibodies, or in some cases, both were positive. So it doesn't say that you have active COVID-19 disease. It says that there might have been some exposure. I think what worried us most is that some of them were IgM positive, which means that this exposure was recent. And if this is recent, then the main thing is to establish whether or not these people were shedding virus, and therefore whether or not they're infectious, and whether or not they place a public health threat to other people around them. And that was important for us to establish, and that's why they went into isolation.
Okay, so what is the difference between the PCR that has been sent off and the tests that they did on board the ship, I think? Explain to us the difference, because I think there is some misunderstanding there by the public as to what is what.
Okay, so as Dr. Duncan said, the rapid tests, the rapid antibody tests, because they're also rapid antigen tests. The rapid antibody test just tells you whether or not you have developed antibodies, the fighting proteins, because you've been exposed to this virus. So that's what the rapid test would say. Whereas the PCR, which is done, you take a swab, whether it's in the nose or the back of the throat, and that goes to Trinidad to the lab at CAFA, that is going to tell you that you actually have virus, you're actually picking up particles of viral tissue, not the body's response to it, but the actual virus particles. And that is what is going to tell us you actually have an ongoing infection, rather than just you have been exposed at some point. And so that is the thing. The PCR, only by PCR positive or negative can we definitively say that yes, you are infected, or you're not currently infected with the novel coronavirus.
Okay, so there are actually two different types of tests that can determine whether one is positive for coronavirus. 2, 3?
In terms of what you know, the PCR versus the rapid test? Or what? Well, those are the two that we use. We use either the PCR so when we say that there's a case, we 16, 17, 18, or there's a new case, we mean that's positive by PCR, which only positive by PCR, which means the genetic material for the SARS-CoV-2 virus has been detected in a nasopharyngeal sample. If we say you're positive on rapid test, whether it is IgG or IgM antibody, it simply means that you were exposed at some point to this virus and your body has produced these antibodies. Whether or not that infection is current, the rapid antibody test cannot say. Whether or not that you're infectious, again, that rapid antibody test cannot say that. That could only be determined by the PCR.
Yes.
Okay, so what's happening now in terms of the other sailors who are actually on board the ship?
So those sailors on the rapid antibody test, they came up as negative, both for IgG and IgM on the rapid test. However, because as we just said, you cannot definitively say that this person is infected or not on just the rapid test. On the rapid test, you have to have the PCR. We have also done swabs for those persons, and we are awaiting the results for those persons. So when we get all of the results, we will then determine who needs to be in isolation, which would be a positive PCR, meaning infection would be isolation, or who can go home and be in quarantine. And why would we still, because you might say, well, you have had a negative PCR. However, we must know that for the PCR to become positive, and I think we've spoken about this already, normally you require an infection. You have to have had the infection for about 5 days before the PCR becomes positive. So if you think about it, we might do the swab yesterday, which is on Tuesday, and the person was actually infected, say, on Sunday. So that when we did it on Tuesday,
it would not
necessarily show up. And so that is why we can't say go home and not quarantine. You need to stay in quarantine still, because if you had an infection, you became infected on Sunday, the test we did on Tuesday might not show up. And so we need persons to still continue on the 14 days strict quarantine at home. You don't want persons going down the road to the shop. We don't want persons going to a funeral. You need to stay at home for that entire period of time. And then at the end of that period, or certainly before the 14 days, we are going to do some further assessments to be sure.
So in effect, we're saying that the 29 who are now in isolation or quarantine?
Isolation/quarantine, we prefer to say.
That among the other remaining persons who we think may be okay, that they could well also turn up a positive test?
They very well could, because if they're still in the incubation period, that could happen.
Because also, remember the rapid test. So whereas the PCR, you need to have, you expect around 5. With the rapid antibody testing, you're talking about day 7. So that you could have somebody who turns up with a positive PCR, but a negative antibody test, even though you should have at least some IgM antibody by then, but it is still possible.
How do you respond to the comment that we should set up our own PCR capability as soon as possible so that we don't have to send our tests to Trinidad? Is that feasible?
So, as you know, we received our PCR machine about 2 Fridays ago, and we are currently setting it up. Now, the setup, it's not just that you open the box and you use it. You have to complete a series of 3 rooms because this is an instrument you're going to be processing samples that you need to have a certain level of safety in your lab. So we are in the process of doing that, and hopefully completion of the preparation of those rooms, completion of the setup, the training, and so on, we would be able to do some testing within the next week or so. But even while we have that, and you might notice that even in St. Lucia, where they have that facility, in Dominica, you have that facility, St. Kitts, a lot of the other islands, we still send samples to Trinidad, to the Caribbean Public Health Agency, the public health lab there, because we need to have it validated. We need to have the results almost certified, cross-match. Is what we are getting here at our lab, is it at this accredited lab, so that we are certain that our results are accurate. So even when we have it, we will still have to send some samples to CAFA for that validation.
Okay, some but not all?
Not necessarily all.
Okay, what are the other accredited testing
facilities in the region? Jamaica has some accreditation also. And then some of the French countries, French islands. But for the CARICOM region, and definitely for the OSS, CAFA we have to send to.
Okay. Let's talk about the importance of testing. I've heard comments such as we're not doing enough of that here in St. Vincent and the Grenadines. What really is the situation? I think we have a certain amount of tests available, and what is happening where these are concerned?
Well, we have rapid tests available. We have a significant volume because we've had, since the last time we spoke, I said we had, 1,500, was it, Simone? I can't remember.
Yeah, we had initially 3,000.
3,000, right, really. And now we've added another 8,000 to that thing. So what these antibody rapid tests are going to help us to do, they're going to, as I said before the last one, I would say they help us in contact tracing, especially when you're looking for people weeks or months after the event would have taken place. So it's helping us with that. It's also helping us to establish whether or not, what level of exposure really is within the population, especially our frontline people. And we're talking about people who work in healthcare, we're talking about our security forces, people who are working in aviation, the airport, Royal International Airport staff and other airport staff. And we talk about immigration officers and customs officers, people who we think are frontline. And to give us some sort of idea what sort of activity there is, COVID-19, SARS-CoV-2 virus activity within the population based on the presence or absence of these antibodies. And that would give us a good picture of what it is that's really going on. Later on, we would probably want to roll out we are going to roll out into a national sort of severe prevalence kind of study, doing a random sample of the entire population to see whether or not, there's high SARS-CoV-2 virus activity or whether or not there isn't. And that is going to allow us to plan. In a couple of weeks, regional international travel is about to resume. This for everybody in the world. These are uncharted waters. These are unknown times. These are things that you just don't know what is going to happen. So if you have some understanding what immunity is in your population, then that could help you to plan, in terms of what sort of risks you take, what risks you don't want to take, and, how you could plan better for the threat of COVID-19.
I think when we come back, we'd like to talk a little bit about that, the reopening of other borders, because our borders are really not closed per se, but certainly with the reopening for the borders, there must be some implications. And I think that you guys do have some things in the works to deal with that, some mechanism in place. We'll talk about that when we come back in our next segment.
You've got a friend in me. You've got a friend in me. You got troubles and I got them too. There isn't anything I would not do for you. You've got a friend in me. You've got a friend in me.
Unbelievable but true. The Lotto jackpot has climbed again. Friday, May 29th. is your chance to be a millionaire. With a lotto jackpot of $1,685,000. You can make your dreams a reality. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next lotto jackpot, $1,685,000.
Welcome back. At the break, we were talking about the fact that borders are reopening. People would soon be coming back into St. Vincent and the Grenadines by air, by sea, by whatever means. What are the plans that the ministry has in place to facilitate that reopening? Will there be testing prior to or on arrival? What is the game plan here? And just before you guys answer, just a reminder that you can send your questions, your comments, your concerns via Facebook, and we'll be sure to respond. Who wants to go first?
So I will start, and Dr. Duncan, as the Port Health person, finishes up. So, as you said, I think there are about 2 OECS countries who are scheduled to reopen their borders on June 4th, that's next week. But we, as you said also, we never close our borders. But we anticipate that with them opening their borders and other countries within the region planning to open their borders and to allow for intra-regional travel, that we will be soon welcoming flights, whether they're flights like Liat or so. The process is going to be determined a lot in terms of what other countries want. This is for persons leaving. For persons coming in, we have been in discussions within health and also with immigration, customs, airport, the Port Authority, in terms of what, and the Tourism Authority and the Ministry of Tourism, in terms of what we would want and what would be feasible with somebody coming in. And here we go again in terms of testing, because some countries are asking for PCR tests, whether it's before you come in, and we have had some requests for that already, because some countries in Europe require that you have a negative PCR done before they would let you come into their country. How the availability of a PCR is not that easy, as we know, and there's some move towards rapid testing. And so we are discussing for persons coming into St. Vincent, depending on how long you're going to stay and where you're coming from, because even though there's COVID all over, there are certain areas where you have a greater risk, whether or not we would require a PCR or rapid test. And the timing of that, as we just discussed, is going to be very important. But we do not have any fixed requirements as yet. As it is now, if you still come into St. Vincent, wherever you're coming from, you need to do a 14-day quarantine. Mm-hmm.
So, once people start moving again, it's going to be, the risk, of course, of COVID-19 entering again increases significantly, and therefore we have to again continue to not just to maintain our ability to detect and isolate, and especially through our surveillance system, as well as people who are in quarantine, how we're able to follow them. And we're working and building these electronic platforms. It's going to make it easier for us to actually track and follow people. There's some options that we consider, which we will decide on shortly. There's some apps to be used by people, by patients, to general public, and some applications to be used by healthcare providers, which would allow us to be a little more nimble in terms of our surveillance. Because we have a small public health team. It's not a huge one, and we really need to move with speed, in order to be able to detect and isolate people who could be infected with COVID-19. And that is going to be a challenge, I think, for us in the coming weeks again.
But is there a regional or a CARICOM plan where that is concerned?
Well,
is there a regional approach?
There is some discussion. I mean, these things are, they're really hard and difficult. You don't get countries to really agree. And one country X might say, well, you have to finally agree with that. And then 2 weeks later, they change their mind and say, well, we're imposing this restriction or we're imposing that restriction. And what we're trying to find really is a sensible balance between allowing people to move and protecting the public's health. And that is, that is difficult. And, something that you have to keep going at and going hard at and studying. But that's what we're trying to achieve. How do we allow people to move, and people who want to enjoy our country, we allow you to enjoy it, but at the same time protecting the public's health. And that's what we want to do. So we want to know who's coming, we want to know where you're coming from, and then that would give us a sense of what this risk is, and then we begin to mitigate for that particular risk. And on our side, we need to continue to build capacity, to early detect, to isolate, to contact trace, and to treat.
I noticed that there have been some thermometers that have been introduced locally.
Scanning.
Scanning.
Right. So we've gotten some donations. We had from the Taiwanese, they donated some thermal scanners. We also got some donations from Storm Gonzalez Drew, and he acted representing a donor. So we have some of those. So as Roger said, the entry, especially entry into your country, is going to be surveillance, heightened surveillance. So it would include a temperature scan, but not just that alone. We'd also be where you're coming from, as we said, and it might be that you have to come in with a PCR, or you might have a rapid test done on entry or before you come in, and then you have a PCR done. We have also anticipated the receipt of 2 PCR point-of-care units, meaning things that can be used, say, not in a lab as we have with the PCR machine we have now, but we might be considering using that at one of our ports of entry. So the system is going to be most likely a combination of rapid tests and PCRs, depending on if you're coming in and where you're coming from and how long you're going to stay. So the scanners are going to help, but they will not be the only instrument used in terms of the surveillance and determining if somebody is at risk, greater risk for having active COVID.
And where would they be located? Both at sea and airports?
Sea and airports, as well as air testing for PCR. It's a mobile gadget that you could probably stick in a box and walk around with, so it could pop up anywhere that we want it to be.
Mm-hmm. Okay. I know in our earlier conversation earlier in May, there were some concerns the way people were reporting symptoms or suspected symptoms. Have these numbers come down considerably in terms of people going to the hospitals or calling the hotline? How has that been going?
Well, Simone is a COVID hotline expert.
We have not, we no longer receive as many calls. However, the system is such now that once the lines are up, sometimes you have the problems with the lines, that the calls go directly to the teams. So we have response teams in each area. So the call comes into the hotline, and the hotline operators know immediately who they should direct the call to, and that goes straight to them. And based on the assessment by those community teams, then a swab might be done or not. So we are still responding. I don't think probably the anxiety is not as great.
It has subsided somewhat.
So they respond. The calls are less. They're more specific than before, and then people also use the hotline now as a general information site. So they might call,
more education and awareness.
And what do you do
if
you have somebody who wants to come home? And so the hotline is being used to direct queries.
All right, we have our first question. Do we have everything in place to facilitate travelers? think we may have kind of.
We did touch on some, but everything. I mean, we're not going to say yes. We have everything. I mean, and again, this is just unknown, uncharted waters for us. So you probably don't even have a complete checklist of everything that you need. So the key things are to, one, as we said before, know where people are coming from, know where you're coming from, know what kind of COVID activity is taking place where you're coming from, and on our end to be able to, well, either using a PCR rapid test, as Simone indicated, as well as to be able to early detect, isolate, contact trace, and treat. And that's what we keep building. I mean, we're not perfect at it. Don't think we're going to be anytime soon, but it's something that we need to keep building and building on and building on. And
someone else wants to know, when countries begin opening up their borders, how long do you anticipate the 14-day mandatory quarantine will no longer be required? Well, that's a good question. Structurally, that clearly would not be required. And that's really something that we've been talking about. Because if I'm leaving to come, for my sister's wedding or my uncle's funeral, I really don't want to come for 14 days in quarantine and then to be going wrong. And that is where, again, our tested would come in handy in terms of determining very quickly, early in the game, as to, what sort of risk you have. Should we allow you to go or should we allow you not to go? But it's just a real question. It's something that a lot of people have been asking. And it's people planning the traveling. And this is going to be a question. The answer to this question is going to determine whether or not people come or not. But I don't see that the 14-day quarantine being implemented for a long period of time. And we're going to have to begin to phase that out and probably replace that with some sort of testing on entry or during your first few days in the country. Something like that. How problematic or how feasible would this testing on entry be?
So the rapid test in terms of processing takes about half an hour. The longest part of it is drawing the blood if you're actually taking a blood sample. Some of the rapid tests actually just use a finger stick, and then so you can have a result. So that's what. So the thought is that you might come into a country, and you have a test done, and you're asked to stay in your hotel room for another few hours or so while you get your test. Now, the problem with that is then suppose you turn out to be then you're stuck. So that's why almost like a vaccination, before you leave, it should be that you probably have maybe a rapid test, or a rapid antibody, or if we get into antigen tests, you have that before you leave so that you're coming in with a sort of passport. And then you could probably have the PCR when you actually get here, which would then say, okay, you don't have the virus, the active virus particles, virus now. You also have a clear antibody test that says, I don't have anything cooking, and so therefore, and I'm coming from a low-risk area, so this person would be allowed to. So that's what we are working on. So it's going to be a mix, and it's going to be a mixed protocol. It's going to depend very much on where you're coming from. Huh?
Okay, somebody wants to know, when are you going to do random testing?
Oh, we're doing random testing all now, and we're pretty liberal with it, and we're not prohibiting people. Of course, there has to be some sort of reason why you need to have this test done, but random testing is available. Have a conversation with any healthcare provider, and they could direct you to the pathway to having a random test done.
There's another question. Don't see it yet on the screen. There we go. Hi, Jose Jackson Malete in Michigan. Good to hear from you. Who will bear the cost for the test on arrival, or will it be free? Good question.
Yeah, very good question. Again, we're still talking about it, but I believe that this is a public health good. And as a public health good, I think that we should bear the cost for this. Particularly for the rapid testing. I think that we could be able to do this. If there's a cost, for people who are in business and so forth, who are moving their staff and their workers around, there could be a cost for this. And of course, people who, can't afford it, we could have a conversation. But we really don't want to interrupt travel. We don't really want to interrupt trade, but we also want to keep the population safe. So, it's something we could talk about.
And we'll be back in just a moment.
You've got a friend in me. You've got a friend in me. You got troubles and I got them too. There isn't anything I would not do for you. You got a friend in me. You got a friend in me.
Unbelievable but true. The Lotto jackpot has climbed again. Friday, May 29th. It's your chance to be a millionaire. With a Lotto jackpot of $1,685,000. You can make your dreams a reality. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next Lotto jackpot, $1,685,000.
Welcome back. We were talking about the whole question of random testing when we took our last break. Let me ask a question. I go to a private doctor, get my test done. What is the process here? He takes whatever sample and can this happen?
Should it happen?
Should it happen?
Should it happen? Okay, so as we know, COVID-19 was listed as a notifiable disease under the Public Health Act, and that was done in March, April, I'm trying to remember. And that means, as with other notifiable diseases, that you have to inform the Ministry of Health, Wellness and Environment of the existence. Now, a notifiable disease says that the revision says that if you suspect that somebody has COVID, you are required to report it. Also, there's a requirement, that requirement is for the practitioner as well as the individual. So strictly speaking, if you went to your doctor, your private doctor, and that doctor thought that you might be somebody who had COVID in the past, because if you're thinking the person has COVID now, that's a whole different process of isolating the person, doing the swab, and that would obviously be reported to us. So if you thought the person had it in the past and the person just wants to know, maybe I did have it, if you're going to send that person for a test, there's a special form you need to use as a surveillance form, because we want to be able to track that person, who they might have been in contact with, what symptoms they might have had, and you need to inform the ministry that you are doing this test. So the same thing would apply to a lab, that they should be reporting if they have the capacity to do it in a lab. It would be that they should be reporting that information to the Ministry of Health, so that we can know that, just as we are talking about the randoms, you might find a positive out there, we need to know about that. And you find a negative out there, we also need to know that, there's one more Vincentian who's negative.
We'll talk about if there are any consequences if that is not done, but there's a question, and someone wants to know, is it a requirement for staff to have their temperatures checked upon entering the MCMH and other healthcare facilities presently? Doctors?
No, it's not.
No, it's not.
Not currently. It's not currently a requirement. This is a question, though, because as we move forward, And as COVID becomes something that we live with, that is one of the recommendations that should be considered, in that people coming into work, what's their temperature? We're doing, the recommendations there also for some schools. At the airport, when you are coming in, you should be checking the temperature. So it is something that should definitely be considered, and we are actually working towards. So we mentioned putting the scanners at the ports of entry. We've also discussed putting scanners
in schools.
We're thinking of at the MCMH. Other larger healthcare facilities, and then as you roll out gradually. But as we have always said, the temperature scanning cannot be a standalone. It cannot be the only thing that you use to determine if somebody is at risk.
So we have another question, and it seems to be a pretty long one. So it's considering that health officials have stated previously that no significant medical intervention / treatment was needed for previously positive COVID-19 cases in SVG, and that the persons got through the virus on their own, what is the likelihood that there are or may have been persons in the country who may have had the coronavirus and similarly self-treated their symptoms and got through the virus on their own? Has the Ministry of Health, Wellness, etc. explored this possibility?
Well, in terms of how much people, we can't say, but it's quite possible that this has happened. And we've always been saying that. We're not simply going to have 100% detection of every single case. And that's why we've been very generous, though, with our rapid tester, trying to see how many people they have antibodies. And based on that number we have, and I think so far it might have been, that's probably just a handful I think we've come up with. We've done some mass screening of some groups of workers and so forth.
Negative.
And they've all turned out to be negative. But there is some, there's some sort of COVID-19 activity that is below the radar that we're not picking up. And I'm sure people could understand why. And it's not, I think, unique to us all. Yeah. It's probably it's a characteristic, actually, of the disease itself. It's part of the natural history of disease.
Okay.
Yeah.
And that's why we really want to do these wide seroprevalence studies to get a good picture of what the level of activity is or was.
And then there's the other thought, too, that even as we move towards doing these sorts of random testing and checking on particular groups, that until you have had the disease circulating within your community for a good few months, you're probably not going to pick up that much. So our initial screening would be at ports of entry. Where did the coronavirus come in? It came in through our ports. So we are looking at our workers at AIA, at different airports, at the seaports. Who are the persons most exposed? So we have persons going out there to respond and do the testing, so we're dealing with our healthcare workers. And who are the persons most at risk? We're looking at our elderly, diabetics and hypertensive. And then we will rule out further, because as time goes on, that's when you're going to really pick up those asymptomatic persons or mildly symptomatic who never presented to a healthcare worker and never tested.
Okay, and Grace Harry wants to know, is there any consideration for KEIZER to accredit these private labs and the government lab?
I don't want to speak about that because it's not my area of expertise, but there's conversation going on about building in-country laboratory networks that would be supported by KEIZER and accredited sort of by KEIZER. So we've done some work. We've talked to Delta the policy already relating to that, and we have already developed some draft legislation. But this is ongoing. So this is something that would come in the future.
Right. So we're going through a stepwise quality assurance process, working along with Caribbean Med Labs, along with Global Fund and KEIZER, in terms of building that capacity and ensuring standards. So, as Doctor said, we have draft legislation. We have a lab policy document, an action plan, which is seeking to ensure quality, certain standards for the different private labs and the public labs. And it would all be, but still maintaining KEIZER as your reference lab, and to ensure that we have certain basic levels of production, so that your result coming out of lab A and lab B and lab C in St. Vincent, we know that that's good quality stuff.
Okay, so talks are really already in progress to facilitate that.
And this is pre-COVID also.
Yeah, long before, and we have moved, the MCMH lab has progressed from basic up to a certain level, and we're moving forward.
Okay, so I am from area A, B, C, and I want to have a test done. I feel I need to have a test done. Can I just get access a test just because I feel I want to have a test done?
Well, if you say you feel like, I'm not sure if you just think you should get a test or whether or not you're feeling something that makes you think that you're ill.
Well, both.
All right. So the advice remains the same. If you think you're ill and you think you might have something, you call the hotline. We'll walk it through with you and we'll get you up to the point of testing. If you think that you're worried about something, I don't know, this might have happened to me, I think I want to have a test, we encourage you to talk with your healthcare worker and we'll walk it through, for you there. I mean, today we had a call. There's a lady called, said that her son had a fever and a sore throat. And I sent a small team to respond to that, and we took nasopharyngeal swabs from both mother and child. Just to make sure. But it's not burdensome, and we're not going to be rationing anything. We're quite generous with both the rapid tests and with both the PCR. And I guess, things are going to get even more generous when our PCR is up and running.
Okay, before we take the break, there's a question, but you would answer that question after the break. But the question is, there's a school of thought that if one's temperature is taken over a period of time and returns normal, that the person is COVID-free. Please shed some light, and we'll do that after the break.
Coronaviruses are a family of viruses that range from the common cold to MERS coronavirus, which is Middle East Respiratory Syndrome coronavirus, and SARS, Severe Acute Respiratory Syndrome coronavirus. Coronaviruses are circulating in animals, and some of these coronaviruses have the capability of transmitting between animals and humans. We call that a spillover event. So coronaviruses typically cause respiratory symptoms, so we recommend basic hand hygiene, such as washing your hands with soap and water, and respiratory hygiene, such as when you sneeze, sneezing into your elbow. Ways to protect yourself against a potential animal source would be to avoid unnecessary, unprotected contact with live animals, and to make sure that you wash your hands thoroughly after contact with an animal, and also to make sure that your meat is cooked thoroughly before consuming. There are no specific treatments for coronaviruses, but symptoms can be treated.
Had to do with whether testing your temperature over time and you are okay, whether or not you are in fact COVID-free, and if you doctors would, there it is again.
Okay, so the thing about COVID, and it's been showing up, I think right now the percentage is about 35% of persons who have COVID will have absolutely no symptoms. They'll be completely asymptomatic. Some persons might be pre-symptomatic, so that even though you check the temperature consistently, and it's normal, it is not likely, but it's not impossible. So you would, we do ask for that. And that's, again, as we say, we always put the things together. So persons who are going into quarantine, we are going to provide them with a sheet where they will check their temperatures. And we expect them to check their temperatures daily and sometimes twice daily. So that if there is a little spike or a spike, we would actually be able to say, okay, let's check you again with a PCR or something like that. If not, at the end of the time, even though you are without any elevations in your temperature, we might still want to test you again. But it's not something that is foolproof, but it is an indicator. Okay?
Okay. So an asymptomatic person remains that way for how long?
Asymptomatic? Well, forever. You
never
no signs
actually
or
have
anything.
any symptoms.
You remain that forever. But still, I still want us to be a little cautious here, Simone. Simone doesn't like when I say this all the time, but I still believe at some point each person develops some sort of symptom. It might be very mild. I had a cough, but I was outside. I was sweeping the yard, so I thought it was the dust. Or I felt a little chilly last night, but it only lasted for this one night. So we think that is, we don't pay any attention to that. And some of the literature is now saying that at some point, most people go on to develop some sort of symptom. But there are people, whose level of symptoms doesn't really concern them or bother them, doesn't make them think that anything is wrong, and doesn't make them seek any health care. So that is what we ought to be looking out for all the time.
So that scares me a bit. So you're always asymptomatic, so that means that somebody is always at risk at contracting these symptoms from you then?
Well, this is what it is, because you ill, you show no symptoms, you're there. You get better, we don't know what point you'll get better, at what point you stop shedding virus. We know that you shed the most virus at least a day before if you have any symptoms, a day before you have symptoms, and probably up to the first 3 or 4 days after you have symptoms. That's when you shed the most virus, so it's when you're most infectious. So we don't know, and that is why all this conversation about social distancing and physical distancing is important. The advice to wear a mask if you're in closed spaces and so forth, to avoid large gathering and to avoid crowds. And that is why that sort of advice is taking place.
Thank you, Doc. Can you please again explain to the public what is meant when you say that someone has tested positive for exposure to COVID-19? Thank you, Claudette Laidlaw-Williams.
You want to go again, Simone?
Okay, so basically, if I come into contact with COVID, somebody has COVID, and I am around that person, my body might respond by trying to fight that invasion of virus by producing antibodies. There are 2 types of antibodies generally. There's the IgM, which is the first antibody the body produces, and followed then is the IgG. So when we do the rapid antibody test, there are different types of tests. There's some tests will just tell you have antibodies. They won't tell you if it's a IgM early or IgG late. And there's some tests that would actually say, such as the ones we done on the Caribbean cruise line crew members, that would say that the person had IgM and IgG. So you have been exposed, and that's what we want to say, because you can have been exposed, but you're not actively carrying the virus. And so that is the exposure that we get from the antibody. So
you were exposed at some point in time?
At some point in time, you've been exposed. That's the most we are going to say on that. We're not going to, you cannot diagnose that you currently have COVID-19 on an antibody test. As Dr. Duncan was saying, we have been doing quite a few antibody tests. We have had persons who would turn up as a positive on the antibody test, and then their PCR would be negative.
Are there any plans for living with the virus in the near future? The changes that SVG has to go through? Cap Stevens in Georgia, I think. Thanks for your question. And I think, yes, that's a game plan, Doctor.
Yeah, we say living well with it. Living well with it. So that's living well with it if you're diabetic or hypertensive. So we are modifying our programs for diabetics, hypertensive, the elderly, in terms of how do you reduce your risk. Generally, that is improving the control of your disease. Living well with it. How do we go to school and maintain safety? Living well with it. How do we reopen our tourism and welcome persons, at the same time keeping us safe, picking up somebody who is possibly has COVID as quickly as possible and isolating them. So all of our measures, the way we are thinking moving forward, initially we were in the keep it out. Then we have it in, how do we contain it? Now we need to move towards how do we continue to live and live well, and how do we actually come out of this experience a stronger, a healthier, more with better, even greater surveillance and the greater capacity to respond. So we went into this without sufficient isolation capacity. We are coming out with significantly improved isolation capacity to deal with not just COVID, but other highly infectious diseases.
Testing capacity.
Testing capacity. The PCR is not just for COVID. Training. The doctor mentioned the capacity to use IT to allow for us to do better surveillance and tracking. How do we use that to increase general surveillance, not just for COVID? So that is our intention, that we come out of this stronger and healthier and more resilient.
And before you go, Doc, I would like to do a follow-up on the temperature checks at AIA. Will there be any other system in place, and for how long, for passengers coming from hotspots of the COVID-19 virus?
Well, any other system in place, I'm not sure, but what the person is asking, but I would try to answer that. So apart from the temperature scan, we still got to do surveillance. So we still got to ask you where you come from, where you've been in the last 14 days. We're going to ask you how you're feeling and that sort of thing. And then there's going to be a termination. There's a little formula at the back of that questionnaire that we use that would determine whether or not you're high or low risk, and then what actions would be taken. We did mention there's a possibility that we could offer you either rapid testing or PCR upon arrival, or even before you get to St. Vincent the Grenadines, we'd ask you to please come with a rapid test result or PCR result, depending on where you're coming from and the duration of your stay and the purpose of your visit.
And we think that's going to continue.
Yeah.
Like we're not seeing an end date to that sort of system.
Listen, yes, 357 crew members came into the country yesterday. More of them are expected. What's the game plan? They're going to be reintegrated into the various communities. What's going to happen? How soon do we expect those results to come back from Trinidad? And what happens thereafter?
Well, we expect results to begin to come in sometime this evening, I think, Simone. Okay, and they would continue to come in, I think, tomorrow and probably the day after. So that's the game plan. And we have our interest in these seamen doesn't go anywhere beyond the possible exposure to SARS-CoV-2 virus. We have no special interest in anyone. We're not tracing anyone down. We're not doing anything of that to the sort. This is our only sole interest, your possible exposure to SARS-CoV-2 virus, and how we could keep you safe, keep your family safe, and keep our community safe, and keep the country safe. So we're not interested in the other peripheral things, and we won't really be bothered by that. Okay. The thing is, though, we've had a lot of these people, and it happened with some of the people who came in from the BVI also, that are not adhering to the quarantine guidelines. I mean, we've preached, we've begged, we've pleaded, please, you're in quarantine, stay away, be scarce. You don't have to go down the road. You don't have to go try to rent the car this weekend. Hold on for 2 weekends before you rent the car and start to move. You don't have to get the goat to cook and that kind of thing. And, you chill for a
The
little
goat
bit.
is always there.
Be responsible to your family, be responsible to your friends, be responsible to your community, please. I mean, we simply cannot chase down these 300 and something people. We cannot. We won't be able to. And if we think we're going to try to do it, it's going to be possible. Of course, we'll call, we'll try to check in, but people are moving. But please adhere to the quarantine guidelines. Your friends and family, we ask your friends and family to also ask you to adhere. So if you turn up the neighbor's place, your neighbor kindly asks you, please to go back home, please to stay home, please don't come outside. And this is really what we're worried about. We do this primarily for one single reason. I mean, is to protect the public's health. We don't want to inconvenience you. We don't want to curtail your freedom of any type. We simply want to be able to keep you safe and have you keep your family and your community safe.
Yes, so that's exactly our challenge. We have 357. We have 100 next week from Royal. Probably that's what we are hoping to do. Then we have about 75 persons coming on Norwegian Cruise Line the second week of June. And then we are also working with another company out of Southampton. But the important thing, we have managed since March 11th to keep our numbers down without having to implement any sort of restrictions to persons in terms of their moving in St. Vincent and the Grenadines. It is extremely important that we keep it that way. We need to, if you have COVID, if you are at risk, as we just said, your PCR might come up at negative, your rapid might be negative. That does not mean that you could not still have it. And so the best defense we have, therefore, is for you to stay in that quarantine for 14 days. And what do we mean by that? You're not going to say, okay, I need to go get some bread down the road, so I'll just run down and put on my mask and come back up. That's not going to cut it. We need you to stay. It is, as Doctor said, for your safety. It's for your granny's safety. It is for your neighbor's safety. It's for the entire country. That we have to work together on this. We have to keep it in. You see lots of persons, like in the States now, there's now a program on where they are training persons to do contact tracing, because the realization is this is what is really needed. We don't need to test our contact tracing anymore. It is excellent, but if you stay at home and you maintain that quarantine, that puts less stress on the system and decreases the risk. Persons are coming out from these ships, and these are high risk. There's no denying that. These are high risk environments in terms of lots of these ships have had active outbreaks. And so these persons are coming, they have a different risk than somebody coming from, say, University Hall in Jamaica. We ask the persons from Jamaica to stay put.
Do the same thing.
Do the same thing. We really are asking these persons, be responsible. We would be responsible. We welcome you home. We all Vincentians, but we need you to take care of us just as we are taking care of you. Right?
And that's a perfect note on which to end this evening's edition of Roundtable Talk. Very special thank you to you, CMO, Dr. KEIZER, and of course, MOH, Dr. Duncan. Thank you, guys. And we want to say thank you for the wonderful job. I know it's not easy doing what you guys are doing. And on behalf of St. Vincent and the Grenadines, thank you. And thank you for coming and talking and sharing with us this evening. That's our program for this evening. Thank you for listening, for your questions, and for viewing. My name is Teresa Daniel. Do have a pleasant Wednesday evening. Goodbye.
There are two ways in which we can measure the extent of infection of COVID-19. The first is to find active cases. That means who is infected right now. We do this through surveillance, and we use a test called molecular testing, or PCR testing, and that finds active cases. The second way in which we can measure the extent of infection is through seroepidemiologic studies. These studies will measure the level of antibodies in a person, and antibodies develop 1 to 2 weeks after infection. And through these serologic investigations, what we can measure is the number of people who have these antibodies, and this tells us how many people had been infected with COVID-19. Some countries are considering the use of an immunity passport or certificate to indicate that someone who had been infected with COVID-19 is now immune to the virus. From what we know right now about the tests that are able to measure an antibody response in an individual who has been infected with COVID-19, we don't know if that antibody response actually means that they're immune. These studies are currently underway. We're also concerned about the use of such a certificate because it may mean that someone who has the certificate will not adhere to public health measures that they need to continue to adhere to. We expect that people who are infected with COVID-19 develop a response which will provide some level of protection. There are studies underway right now to determine how strong that protection is in terms of immunity and for how long that will last.
You've got a friend in me. You've got a friend in me. You got troubles and I got them too. There isn't anything I would not do for you. You've got a friend in me. You've got a friend in me.
Unbelievable but true. The Lotto jackpot has climbed again. Friday, May 29th. It's your chance to be a millionaire. With a Lotto jackpot of $1,685,000. You can make your dreams a reality. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next Lotto jackpot, $1,685,000.